Hi, everybody. Welcome. Welcome. Thanks for joining today. I'm so super excited. Today, we get to get our questions answered. I know that for the past few weeks, we've been having different topics, and mothers, parents have said, we have questions. We want direct answers, and that's why we are here today. So thank you for joining. In case it's your first time, my name is Dr. Ayo Adenuga. I'm the host for the Action for Teens and Moms Health, and our goal is to increase the parenting confidence, remove the overwhelm of adolescents, and improve your ability to engage your teens for remarkable results. So thank you for joining today. It's so awesome. I'm super duper excited because Dr. Uche, a lovely longtime colleague, gets to join us today. I'm so happy. She's going to introduce herself. I'm so honored to have her. I just checked her up. I said, I need you. I want answers for mothers, for parents, for teenagers. Can you help? She didn't even blink. She was like, sure, that is what I'm here for. I'm here to serve. So thank you for joining, Dr. Uchenna. I'll allow you to introduce yourself, please.
Thank you so much. I am very honored to be included in your wonderful programs that I've watched. My name is Uche Osayimwen. I'm a general pediatrician located in Illinois. And I go way back to medical school in Ibadan. I'm so happy to be here, and I look forward to, having wonderful conversations. This is what I do every day, talking to parents and kids. So it's going to be fun, I'm hoping.
It is going to be fun. You're a rock star. You're a rock star.
Thank you.
Around. People are going to enjoy their time here. And for those that are not even able to join, it's being recorded and it will be shared later, making sure that it's a lifelong lesson for people. Yes. So I'm going to go ahead to share the slides. Okay, can we all see my screen?
Yes.
Awesome. So this is the first one. And I would allow you to go on.
Okay, so this was just, I know it's an question and answer. So I just wanted to kind of do a quick overview of what adolescence is, and then we can ask, answer questions. Some questions came ahead of time, and I will ask those questions and we'll, answer them. So what is adolescence? So this is a period of transition between childhood and adulthood. And it's a pretty wide-ranging period where there's some big changes, mostly physically, to the body, from the way a child looks, a younger child, to starting to become an adolescent, and the way they relate to the world and the way they see their position in the world. Many changes are physical. There's some cognitive changes, emotional changes for sure, which I'm sure a lot of parents notice. Social changes and sexual changes also. Next slide, please. All right, so the stages, there are 3 stages. So early adolescence is from age 10 to 13, and it's commonly called, 10 to 12 is called the twin period, so before they're teenagers. So that's early adolescence. And then the middle is ages 14 to 17. So that's kind of your fully established, teenager. And then late adolescence, believe it or not, 18 to 21, and even some people will go up to say under 25, you're still considered like an adolescent, young adult. So these are the 3 main stages, and there are different things that will kind of characterize them. Please, can you transition to the next? Okay. So early adolescence, which is the 10 to 13 year stage, is typically where puberty starts. That's generally. However, for us in pediatrics, puberty is defined as, body changes that start from age 8 in girls, which seems really young, because I remember when I was 8, I definitely was not thinking about body changes. But if
absolutely,
the patient presented with, starting to have a little bit of breast buds and all, it would be considered normal. Caucasian females are a little later, but Black, and African American patients tend to be around that 8, 9 stage. For boys, it's typically defined as 9. Anything under 9 for a boy will be considered abnormal, like precocious puberty. Anything under 8 for a girl will be considered, so a 7.5-year-old girl with breast buds will be considered early. And that would be something that would need to be evaluated. But generally speaking, it's about 10 to 13 for the range. Yes. For these stages, the main thing is kind of like the critical thinking, things are either right or wrong. There's no in between. It's either black or white. It's like it's hard to like see between the lines. It's just, no, this is right, this is wrong, and that's it. They're starting to have some privacy needs. You start noticing being, a child who was walking around in underwear suddenly is like, Mom, shut the door, They're starting to notice, want to kind of have a little bit of privacy. And also boundaries too. You start to notice, wait, you were like an always yes kid. What's happening, Starting to kind of try to push the boundaries to see how far we can go.
Yeah, so absolutely. Which I remember the day I got into my daughter's room. She's turning 10 this year. Yeah. And she was like, oh, Mom. I was like, what? I was trying to look at what she was covering. I was like, yes. So it's really starting to be thing.
Yes, it is starting to be body aware and just, so middle adolescence is 14 to 17. So usually by 14, puberty is fully established for most kids. Of course, there's a range in medicine, right? There's no absolute. So between 14 and 17, most people are probably, like for girls already, most girls have gotten their periods by then. And but some might not, but most around there, by 17, typically it's fully established. Definitely more starting to obtain, try to get independence from parents. So you might get some, before it was like, okay, pushing boundaries, you might start getting arguments now, like, why can't I go stay later than the curfew? Why? You have to tell me, like, why? Especially in this part of the world, I feel like those of us from Nigeria, it's a little different. I think our adolescence in Nigeria probably lasts way until past college because the parents the be all, they say, it's not a democracy.
It isn't.
Not, but here is a whole different thing. You have to explain yourself.
Yeah.
So there's a lot more arguments. Definitely wanting to spend more time with friends. You'll notice always in their room, talking to friends, and now with social media on chatting with friends, always wanting to be behind that closed door in their bedroom. And you're like, you need to be part of the house, but that's kind of, friends are more higher up, let's say, Bobby, we have to go out tomorrow to Auntie's something. No, my friend invited me. I don't want to go to Auntie's playing. I want to go with my friends. So less time with family, more time with friends. Starting to have interest in romance, like starting to be, 10 to 13, boys are like, ew, or girls are like, ew, I don't want that. 14, they're starting to notice the opposite sex or, and like starting to be interested in, okay, this person, is nice, looks nice, looked at me this way, said this. So starting to have some of that interest and even more, depending on the kid. And then there's some abstract thinking too. It's like, well, like I know everything. So even if you say, example I use, because now marijuana is legal in most places, you're like, no, but it's not good for you. Why? It's legal, so it can't be that bad. If the government thought it was bad, like it's all this whole conversation, they wouldn't make it legal. Exactly. So it's starting to have this kind of thinking that as like, I know what I'm saying, that kind of thing. Yeah.
Independent thinking, being able to form their own opinions now based on the environment.
Yes.
Awesome.
Yeah. So late adolescence is like 18 to 21. So, physical development is typically fully complete. Height is achieved. You're not growing any taller, likely. Periods are fully established. Boys probably have their beards and everything fully, come in. And at this stage, though, it's interesting because they start to move more to better impulse control. They're starting to be like, okay, you know what? I'm in college or working. And yes, I could go hang out, but I have to study. So I'm just going to pick that instead. I'm going to try to make better choices. So it's almost like all the things you were saying for the last few years that you were like, oh my God, hitting your head against the wall. So finally starting to come in. They're starting to understand consequences. Well, if I don't do well in this, I might not be able to get a job. I might not be able to, further my career. So those are starting to come in.
Yeah. So what I hear you say is that pre-18 years of a teenager is so important.
Yes.
You forming those values, forming those behaviors that would help them when they're 18 to 21.
Yes. Yes, kind of laying the foundation.
Awesome. Yeah. Okay. So thank you. Yeah. I'm listening.
So no, I just had kind of timed out things, just some general things that are helpful during this period, kind of helping, having conversations early about body changes. I feel like, again, every family is different, but just judging from my family growing up in Nigeria and my cousins, I don't think anybody actually talked to us about, oh, your period. I think I was in boarding school the first day my period came, and I'm like, oh God, I think I
absolutely not.
somewhere. And I thought I was half dying. So starting to kind of and talk about those conversations. Oh, mommy, I noticed that there's a little fuzz under my armpit. That's normal. You're growing. Oh, I just smell. Or somebody's like, tell their sibling or brother, you smell bad. It's like, well, becoming an adolescent, you start to have some of the body odor, which is why you need to shower, stuff like that. So these are good. Starting them early, keeping conversations with your child as positive as you can possibly keep them, as positive as you can, being supportive, but setting clear limits with, I think that, being supportive, but also letting them know what are your boundaries as a family, what are your limits as a family. Discussing risky behavior. Again, this is not something anybody ever talked to me growing up about. You just were told, if you do this, you're in big trouble, whatever. But kind of saying, okay, these are some of the things, these are the consequences of some of these things. This is why we don't do it. This is based on our values or, whatever as a family.
The why for the actions.
What can happen? And then honoring some independence and individuality. Because, oh God, that's my kids. I'm sorry.
That's okay. I love it. It's nice. That's family.
Honoring some independence and individuality, like, yes, maybe sometimes you might give in a little bit, what, okay, fine, you're choosing this time not to do this, I'll allow it, but next time we have, something like that. Yeah.
Okay, that is just mind-blowing. I just love all the way you've synthesized from when they start noticing the preteen, adolescence, post-adolescence is awesome. The change you should be looking out for, the things you would see in both in physical, emotional, mental changes. Thank you so much. That is awesome. So now we're going to start with the reasons why we are here. I just love the fact that we laid a good foundation for this question and answer session, because you may not be able to ask the right questions if you don't understand the background or the foundation of what you're dealing with. So I know that you did mention changes in mental and the way people are, and people did send in their questions. So the first thing I want to do is to first check people that are online to know if they have questions. Okay, I do see people commenting. Okay, so that is okay. So let's go to the question and answer. Please, if you have your questions, please throw them in, then we'll get to answer them. So the first one is, a mother was concerned. She said, my teenage son loves to sleep a lot. Is this okay? Is it fine? What do you have to say to that?
So I think that part of it is, it depends on why. So many times they're sleeping a lot because at night they have their devices, they're on their phone chatting and talking to friends, and while you're asleep, they're talking to their friends, and in the morning they can't get up for bed. So that might be it. And of course, other reasons could be a medical problem if they're not feeling well, anemia, fatigue, but most commonly it's usually screen time. They're watching a show late, even though you've said this is your bedtime, they have a device in their room or bedroom or computer, they're up late chatting to 2, 3 a.m. And then of course, by morning, it's like, oh my gosh, they can't get out of bed.
Absolutely.
So you want to find out what's going on. Make sure, look at the whole screen thing if you need to adjust things with that. And as long as, if you ruled all of that out, you might want to see somebody. If you think, oh yeah, it's not screen time, it could be that there's other medical stuff happening and you should see somebody.
Okay, thank you. That is lovely. I remember having a session with Dr. Funke Afolabi Brown, who is a pediatric sleep doctor. And she did mention that screen time is the major barrier to children actually having quality sleep. And she said the way to help your children is limit their screen time When it's time for bed, try as much as possible to set a consistent, you use the word consistent, consistent time to sleep, consistent time to wake up, have a routine that will make sure that the child is able to have their bath, do a devotional, read a book, and then goes to sleep. Give them a hug. Wear their pajamas, then they go to sleep. Consistent routine actually helps. Thank you so much for that. So the second one is my son talks. So you did mention in your presentation, thank you for that, that they start noticing the opposite sex. They start forming affection, trying to go towards romance. So she was concerned. She said, my son talks about girls a lot. What should I be doing as a parent?
So again, it depends on what age. I'm guessing this person is like in middle adolescence where they're noticing, starting to notice the opposite sex or other people. I think, talking is not bad. You can ask general questions. Okay, what about this person? Are you friends? Is it something else? You want to make sure, first of all, that they have the right idea, of what, is happening. Is it just, oh, she's pretty, she's nice? Is it more than that? But also I think also with the culture, and I've said this to my son, he's still young, he's 12, but, starting to say, like, in this culture, you have to be careful. Like, you do not put your hands on anybody. You don't, it's okay to talk, but you're careful what you say back, and you have to, so that nothing is misconstrued as the wrong thing. But it's not abnormal because it's just hormonal, and they're starting to notice, and you just need to, as a family, decide, okay, we're too young at this, for certain things. If it's just a harmless crush, that's fine. But if it's seeming like might be a little too much fixation, saying, let's reassess. You're too young, depending on the age. These are our limits. This is our age for maybe dating or something like that. This is where we recommend this starting and kind of getting more information, but it's not abnormal at all.
Yeah, absolutely. Thank you. So at this stage, we want to listen to them, learn why they are having this interest. Like you said, ask questions, then lead them, set expectations, let them know what they're supposed to do. So before we go, I want to stop share. I'll still ask all those questions. I want them to see people in the gallery view.
Oh, yes.
Okay? So that we can see people, they're asking questions. And we have a lot of people, here.
Yeah.
So I'm going to still ask the question, but somebody did ask a question right now about bedwetting. So I will go into the chat.
Yes.
And then ask the question.
Okay.
So she did say, so Dr. Titi asks, bedwetting, and when is it expected to stop? My 10-year-old still bedwets. Yeah, this is a major concern of many parents.
Yes.
Thanks for that question. Please, how would you answer that?
Bedwetting, typically in the range of what's considered typical would be most kids will be starting to show interest in potty training by starting at age 2, some interest, like they might want to sit on a potty. Most will not achieve dryness probably till about 3, maybe 2.5 if you're lucky. And under the age, I just had a patient like this today actually, under the age of like even 8 or 9, we don't usually refer them yet. We do other things, try to make sure you limit fluids before bedtime, 1 hour before bed, no more drinking of water or anything. If you're thirsty, do ice chips. Last thing before bed, you go pee. You want to make sure they're not constipated. Children that are constipated, actually, the bladder is pushed on and they will pee. And so you want to control for constipation, make sure they're having normal, soft bowel movements. You want to make sure they're not holding. Young children have bad habits of holding their pee because they're playing and they don't want to stop what they're doing. So after a while, the bladder loses a little dysfunction because it's being over distended.
Wow.
Usually, there's also the online, you can get like a urine bedwetting alarms.
Okay.
You can, it has a sensor that's attached to the underwear and then it will pick up if the kid pees and helps kind of train. Usually though, if you've done all of that and they're like above 8 or 9 and they're still peeing, at that point, we usually refer them to a urologist because some kids might have a bladder dysfunction or irritability and they void. The other thing is the bedwetting runs in families. So I always ask, if a parent had long bedwetting to like above maybe age 5, it's not unusual for a kid to have similar, only because of the structure of the bladder, like body, it's familiar. So those are the things to control for. So typically, if you try all those things, limiting fluids, pee before you go to bed, not constipated, bedwetting alarms, you've done all of that and it's not helpful, talk to your pediatrician, they'll probably refer you. One red flag for bedwetting, if there's bedwetting during the day, that could be something else. So you want to make sure they're not peeing, having accidents, daytime accidents. That might be more medical stuff.
Wow, this is just awesome. Thank you. This is like laser coaching for parents. Thank you. Awesome. I really do hear you. And I like the way you summarized it well.
Yes.
Thank you.
Thank you.
So the next one is, what kind of food should teenagers eat for them to grow healthy? So some parents notice that at the point that children start becoming thin and lanky, and the difference between the teenagers and the children differ. And they're like, okay, am I not feeding this child well? Why is he looking very malnourished? What should parents be doing?
I think that as long as, many times if their teens are doing sports and activities, so they're, burning some calories, as long as they're growing, if they have a yearly checkup and they're maintaining their growth curve, they might look lanky to you, but when they're weighed though, they're still, percentiles are good. I wouldn't worry about it. Just make sure that they're eating well, emphasize fruits and vegetables, not sugary drinks, all of that. If there are other things that are happening, you feel like, the pediatrician notices that maybe they're dipping on their growth curve, then there could be something going on. I would be evaluated for that. But if they're eating well and they're growing, each time you go for a checkup, you're like, nope, they're meeting, they're doing well. I won't worry about it. Yeah.
Awesome. Thanks for that. So mothers, fathers, take a chill pill. Don't be too scared.
Yes.
Pardon?
I was going to say one more thing too. I feel like in our culture, we feel like the way to love on somebody is to feed them, like the kids. So we're trying
to be chubby.
Like, you put in America, you should be horrible. But you should, if they're growing and maintaining their curves, don't worry about it.
Exactly. So before you worry, let them have their annual physical. Once they're within the right percentile, they're just okay. Thank you.
They're fine. Yes.
The next question is, my teenage daughter is pulling away. What can I do?
So again, it kind of goes into that whole starting to try to, move more with peers. That's a little more important than family. It can be distressing as a parent because, it can be this person you are really close to suddenly is not really wants to do anything with you. I would say, as long as, there are other things that could be red signs, like maybe they're depressed or anxious. So if you rule those out, meaning they're still coming to be with the family, they'll still be involved in things with the family, they will still be interested in their normal activities, they're not crying excessively, then it's probably less likely depression. It might just be the normal teen stuff. They're interested, they want to hang out with their friends more. Try to do activities where, like, sometimes in my house, my kids probably get annoyed. I'm like, you know what? We're not doing screen. We are going to hang out with your mommy today. We're going to watch a movie, which annoys them. But, just stuff like that, because you still want, they're your babies still. You want to hang out with them. Yeah. So some of it is just that whole starting to kind of identify themselves. And as I said, by 18 to 21, I think they've gone through that phase and they start coming back. They want to hear your opinions. They want to talk to you and, be interested in what you have to say. So just be consistent, check up on them. I love you. Send them a text. I love you. I miss you.
Yeah, absolutely. Sincerely, you just said it all.
Yeah.
At a point, it is natural for them to want to have their privacy. Already they're overwhelmed with what is going on around their body, their body changes, and they're just trying to find themselves. Okay, so parents have to be understand, rather like, why you locked up? Check, let them know you love them. Let them ask about it. How are you doing? What are you doing today? Listen to them, form that bond, then they will come to you.
Yeah.
And then try to help them in whatever they're doing. And when they see that you are there to help, they can trust you with their problems, they can trust you with their affects, they'll loosen up. Thank you. So the next one is, my 13-year-old goes into mood swings. How can I help him? This is still similar, please.
Yes, it's similar. So, just trying to figure out what are the triggers. Is it certain things? Is it don't be too offended, if, again, in making sure that it's healthy, that's not because they have other mental health concerns, like they're really sad or anything. But if they bounce between, they're very, happy, they're affectionate with the family, they engage with their friends, then it's just a normal changes. And sometimes you might need to step away and give a little space so that, give a little space, but always check in, always be there. And, it might seem annoying, but be like, you know what? I just want to know, I'm interested. How was your day? I like, how's it going? Maybe do an activity they love together. You could do one-on-one with that kid if you have, time, and hang out, just to show them that you care. But it's some of it's just like they can't deal with all the different hormones. Some day are feeling excited, the other day you're like, it can be overwhelming until you get balanced, until they're a little older teens, and then things are a little more balanced, then it's better.
Absolutely. So it takes a parent's understanding of the mental changes that goes on. They're able to empathize. We all went through it sincerely. It's just that sometimes we ourselves as mothers might be stressed, might be impatient. We really need to understand what they're going through. Thank you for that. So the other one is, how can menstruating girls swim during their periods?
That's a really good question.
Now it's summer. Summer is coming.
That's a really good and valid question. So generally, if they can use a tampon, that would be the only way to swim. Most of the tampons advertise that you can have them in for a few hours if you're in the pool. You just have to make sure that they change often. Again, I know growing back in Nigeria, there's some kind of misinformation about tampons. It's going to affect you. You're no longer going to be a virgin, all these things. That's not true. They can use a tampon so that they don't miss out on the summer fun. It's kind of periods come whenever, you can't control it. So you don't want to miss out on a vacation just because swimming while their siblings are swimming. So a tampon is safe. They have to change often, so check in with them and make sure so that you don't get toxic shock syndrome.
Exactly. And my question would be, at what age would you say the tampon would be safe or allowable for a teenage girl?
So when parents ask me, I usually say when you feel like they're responsible enough, because the tampon left in all day can attract bacteria.
Sure.
Actually. So but again, that is different. A 13-year-old might have her act together and is good, and you might have a 15-year-old who's not there yet. So you have to know your child. And that you can trust that, because you're not following them around all day. So just that they know they have to change it and take care of themselves so they don't get sick. So it's really individual. It depends on the child. But I would say probably not this thing to start when you're just getting your period at 10 or 11. But again, if the child is ready and you have discussion, they want to swim, absolutely. That time you might need to help them a little more because they're younger. But I think 13 is a good time if they're mature enough. And if they're not, hold off, because you don't want them to get sick because they forgot that there was one in there all day.
Absolutely. Thank you. That's awesome.
You're welcome.
So the next one is, how do somebody just said something in the chat. Dr. Modupe said, also swimming typically freezes the menstrual flow. I didn't learn this early. Awesome. Good. So during swimming, it freezes the menstrual flow, so you could use tampons, and you won't have that rush. Of course, some people have very heavy periods. You have to know yourself and use the appropriate kind of tampons. For it. You don't want to get colors trailing you while you're swimming.
That will not be good.
Okay, thank you for that.
Yeah.
So how do teenage hormones affect how they feel or react? So a teenager actually mentioned this, people are talking about hormones. How does it affect them in how they feel and react?
So usually when the teenage years are starting, for both girls and boys, they have an upsurge in estrogen and testosterone. And estrogen tends to be, you become a little moody and just, not kind of out of sorts with yourself. Some people feel like that before their period just comes on, when it's the highest levels. And so it affects like the mood and all. It shouldn't be affected in a bad way. It should be temporary effect, and you might notice your child, some people can tell, oh, you're a little irritable, is your period coming? They can look at the calendar and be like, oh my gosh, you're premenstrual. But even boys, because I've seen boys with breast buds, the teenagers and parents are like, why is he having breast? And it's just because in the beginning, estrogen and testosterone start off high for both boys and girls. And then for girls, estrogen goes up, testosterone goes down a little bit, boys. So, there's really moodiness and some irritability. And of course, the body changes, they're self-conscious, so that might make them shy and, all of that because of the body changes. So that's typically what it is. But no, it's a normal process. I always say that to all my patients when they get their first period. I'm like, congratulations, you're growing. This is a good thing. It's very normal. And they're looking at me like you're crazy. Like, it's very normal. It's a good thing. You're doing what your body's doing, what it's supposed to do.
Exactly.
So some of these, and I tell parents, some of these things will happen, just reassure them. If they're not feeling good that day, like, you know what, it's okay. You'll, and I feel like later teens, that equalizes typically, unless they have other underlying health concerns.
Yes, absolutely. Thank you for that. So we'll soon throw it open to everybody, but the last one is about breast cancer. And it's talking about how does it come about. Some people have heard different myths to say, if your bra is dirty, if you keep money there, you're not supposed to keep money in your bra anyway. If your bra is dirty, don't change it. It can cause, breast cancer. And what symptoms does it show besides the lump? We know that everybody will like palpate it, check if there's a lump, check if there's a changes. And some people, they didn't feel any lump and they had breast cancer. So what are the other symptoms that we should look out for? And is breast pain a symptom? I know I've put together a lot of questions into breast cancer, but I can always ask it if you do miss anything out, please.
Yes. So first of all, to reassure people, breast cancer is extremely rare in adolescents. It's not common. It's not impossible because there's no impossible in medicine, right? But it's extremely rare. It's a very common disease, as I said, when kids get that first breast bud, parents run in, oh my God, there's a lump, what is it? And they're worried. However, that being said, some people unfortunately might get breast cancer earlier because of family history and genetic, mutations that they carry, but it's really rare. The lump is like the most common thing, it's a hard lump that typically is not painful. So a painful lump, I tell people, typically isn't breast cancer. There are different cancers where you could get a painful lump, but mostly it's not. It's also a lump that is irregular and most of the time is attached to overlying skin, like it's just stuck, it doesn't move. There are many common lumps actually in adolescents, like fibroadenomas. Those are very common and those are benign. And the way it's like a rolling lump in the breast, usually in the outer quadrant of the breast, and that doesn't hurt. It's firm, but it's not hard and you can move it around. So if you find a lump in your child, it's always a good idea to have it checked. Wearing a dirty bra, not having your bath, all those things, putting money in your bra does not cause breast cancer. It is good to wash your bra. Bacteria, don't put money in your bra either.
Yeah.
So that's good. Apart from the lump, yes, some people, I feel like a lot of times people would have a lump. If they have dense breasts, they might not feel the lump, but they might notice first skin changes. So you can have some dimpling of the areola, some like the peau d'orange we learned to use.
Yeah, the areola is where the nipple is, the skin around
it. And then you can have sometimes inverting of the areola, sometimes some bloody discharge from the nipple. If if a kid has bloody discharge from nipple, that's a concern. If they have those kind of changes, that would be somebody that should be seen. But I think parents are diligent. If there's a lump in a child, and I don't think any pediatrician minds, even if it's a boy, it's a very common visit. And to say, come in. There have been kids where around their period, actually, some people can get fibrocystic changes around their period as hormonal. So they'll have tenderness before their period, and they might have a lump. So what I do in those situations is I say, after your period, if it doesn't go away, then let's go ahead and do an ultrasound. Mammograms are rarely done in young kids because the breast is so dense. It's usually like a breast ultrasound first, and then see what that shows.
Yeah, so the fibrocystic changes are changes in the tissue of the breast. Changes with time based on the hormonal cycle that you're going through.
Yeah.
Thank you. This is awesome. Now we'll before we ask other questions, would like people in the house and the Zoom land, please If you have any question, please unmute yourself and ask your questions, or raise up your hand. I'll unmute you, then you can ask your question. Okay? Anybody with questions? Okay. So while people are thinking about the question, something else that they asked is about the adolescents having a lot of pimples, like breakouts.
Okay.
And you see the adolescents now coming to put different things on their face. I know Dr. Yinka she's a specialist in all those dermatological things, but people want to know, okay, is this normal? And what should I be doing as a parent? You know, sometimes even the parent has pimples more than the child.
Yes.
But it's so concerning for the child that
yes,
they don't want to look abnormal with pimples everywhere.
Pimples,
so what do you have to say?
So again, we have a skin person here. So please correct
Dr.
me.
Yinka Skin.
Correct me if I'm I need to be. So a part of the hormonal changes is acne. The hormones help, like there's a P. acnes, which is a bacteria in the skin, is what will propagate acne. And depending on your skin type, your pores and all, during the hormonal phases, as I said, the hormones can stimulate that from happening, and kids can get breakouts in pimples. Usually, if it's mild, you can just start with a nice wash over the counter that is fine. Just wash your face. Make sure they're using non-pore blocking creams. Like some brands that are good. I don't have any relationship to them, but like Cetaphil. There's some other ones that you can use. And then if that doesn't work and they're having real breakouts, then going to the pediatrician and having a discuss. The one thing that we always say is, don't tell a kid, oh, it's small pimple, don't let it bother you. They are very remember this age, they're self-conscious about their appearance.
Absolutely.
So even one breakout that nobody can see can be very distressing. And so you want to take it seriously, and your provider would too, because you don't want a child having low self-esteem because somebody pointed out they had a pimple, or they just felt like the whole world can see this thing that nobody can see. So you want to take it seriously and just do the normal stuff over the counter, washes, cream. Be careful what you put on. Their skin is still tender, so be careful what you put on. And if they're using makeup, make sure they're washing their brushes and there's the powder things. They're not using the same brush for months and months because it's just going to be packing bacteria, stuff like that. So make sure they're doing those things, and it's not helping. See their pediatrician.
Yeah, thank you. This is just an awesome time. I think we really, really keep the ground running, answering all those questions that parents are asking is just nice. Does anybody I see a lot of people in there, okay? And Dr. Yinka Skin, she did add that acne hits hard and can affect their confidence.
Yes.
Absolutely.
Yes.
I have my son having pimples everywhere. In fact, I call him a pimple rubis. It's just like Voltron. Voltron used to have a lot of rubis, and I was like, okay, you're a pimple rubis right now, but he's so self-conscious and it hits hard. It's all over. And like, okay, what should I be using? Should I be using facial washes?
Yeah.
Should I be using Juju Osu? What should I use? And we'll say, okay, it's normal for now, but like you said, nobody wants to hear that it's normal for now. They want it gone. Especially this age of technology where people take a picture and make their face look absolutely smooth.
Use filters, yeah.
Yeah. So I totally agree.
Benzoyl peroxide, like most of the over-the-counter, like all those brands, Neutrogena, Clara, so they have benzoyl peroxide, which is like a type of antibiotic for the face. It's mild. That could be a wash that can be used, and to start, and just a non-pore blocking cream. If that doesn't work, then going on to see, because there are topical prescriptions that can be prescribed by your pediatrician or dermatologist, depending on how bad. But acne also can run in families. Some people have really bad acne that need like major treatment by dermatologists, and many of pediatricians can handle.
Very true. Very true. Very true. So at what point should the parents say, this acne is beyond normal, you should see a pediatrician or a dermatologist? At what point?
Definitely, if they're having like a lot of deep cystic acne and big, because those can form scars.
Oh, yeah.
If they're having big red bumps, if it's one red bump here or there, but if they're having multiple big bumps on their face, yes, you should see your pediatrician to start. I think it's always a good idea to see your pediatrician because they might be able to, there are not that many pediatric dermatologists around, so there's a wait is long, and you're making this kid is distressed once their face clear. So a good place to start. If they're having really big, deep bumps, for some girls around their period is the worst. They have severe breakouts. Seeing the pediatrician, at that point is a good idea. Not just saying, well, it's normal. The other one I was going to mention was in the summer, like sports. A lot of boys who play sports and have headgear, there's a lot of like grease and oil, so they'll have breakout around where the straps go. Yeah. So that's another thing, making sure they're cleaning those and they're cleaning those and washing their faces. That doesn't work, see the pediatrician.
Thank you. That is awesome. So hi, Dr. Funke Afolabi Brown. And thanks to everybody that is joining. We have thank you. Dr. Ikaskin said, I think we should treat even smaller spots. Thank you, especially black skin. They can still leave scars. Thank you. Okay, so parents, you heard that. Small pimples, smaller spots, bigger spots, you should treat them so that they won't leave scars on the children. Just pay attention to them. Cleanliness is important for them to have this routine of washing their faces. And if it's more than normal, like you said, use treatments for them. So also this are the question: what are good questions to ask a teenager? Okay, concerning what?
In regards to what?
Yes, regards to what? What are good questions to ask a teenager? Well, I'll just say from a parent leader point of view, the questions to ask is to even know what is important to them sometimes in your conversation. Okay. Yeah. In a day-to-day conversation, hi, how are you doing? So how did your day go? Can you run me through your day? Yeah. And then when they say something that you feel is concerning, you ask other questions about that. Okay. Other questions is if the child starts puberty and maybe is menstruating, you could ask, so how do you feel about this? To be able to know how the child is feeling, and you listen and then you lead the child. Okay. Other questions are, what is important to you? If you don't know what is important to your child, you cannot adequately help or lead the child to achieve its good potential. But if you let me know what exactly you're referring to, they would answer them appropriately. So thank you for throwing in that question. Okay, I think we are on the top of the, not the top of the hour, we are in good time, we're in good time. Any other questions? Anybody out there? Do you have any other questions? We have doctors in here. We have Dr. Ochina here, just waiting to answer your questions. But if there is none, we'll just wrap up. Is that fine? Does anybody have any questions? More? Okay, awesome. I don't see any questions in the chat anymore. And so this is very good. And thank you for all your contributions. Thank you for everybody that attended today. It will be posted, okay, on the YouTube channel, on the website. So please go in there and check it out and listen. There's a lot to learn from, okay? And I also challenge you to share with other people, okay? Share with other people that will learn from all this. So
somebody's chatting and saying, are pimples only on the face? And then wrote weight. So I think they want to ask more questions.
Oh, okay. Okay, so let's go on. Let's go on. Yeah.
You can have pimples on any, face, common. Back is also very common. Upper chest area. So anywhere that pimples are should be treated.
Yeah. Absolutely. And I think sometimes it's even embarrassing for sometimes ladies. Let's say they're wearing something like a V-neck and they have like pimples. So you need to attend to it. So I totally agree with you.
Says what?
Back chest. Yeah.
There's a question about what age do you stop getting taller?
Oh, awesome question.
Okay, so for girls, actually 2 years post your period, your height starts to steady because the estrogen closes the growth plate. So it's very common when you're looking at the growth chart, suddenly their height is starting to steady. It doesn't mean you won't grow, but not as much as before. And typically another 2 years post that, likely the height is done, which is why if for precocious puberty, if a girl starts her period before 8, the endocrinologist will stop it because they will not reach their height potential. For boys, though, they have the opposite effect. Typically, once girls are getting that bump of estrogen, they continue to grow, but about 17, 18, typically for boys, their height is achieved. There are rare, instances somebody grew in freshman year in college, but, for girls, 2 years post-period is kind of when it steadies out. So I always tell people, if your girl hasn't gotten her period yet, she's 13, 14, that's not bad. She has a little growing to do. Still, at least to get her height in there before the period comes in and starts slowing things down.
Absolutely. This is awesome. This is awesome. Mothers have this, my daughter, she's about 13, and I know that she started getting tall at a very fast pace. I was like, what's happening? Like, please don't grow too tall. Yeah. She's like, Mommy, I can't help it. But yes, thank you for that. It makes you understand that this is just their time to grow and to normalize, after 2 years. Awesome. Yes. Awesome. This is nice. And then I know my son can now catch up. I'm sure
yes, typically they overtake. Suddenly the boys get taller because they don't have the growth plate closing from the estrogen.
Exactly. Thank you. This is very, very good. It has been very productive. Thank you so much for your time. I really appreciate you coming here. Thank you for everybody that has joined. I have so many people joining today. It's nice to see you all. It's nice to hear you listen, and we'll see you next week. Thank you so much.
Thank you so much. It was an honor to be here.
Thank you. Thank you. Yeah, and I'm sure we're going to have so many more of this collaboration. Thank you. So thank you all. Appreciate you. Have a good night. Bye, and a nice weekend. Bye then. Cheers.
Bye-bye.
Bye.
Bye.
Bye-bye.
Bye, everyone. Great job. Wonderful.
Thank you. Thank you.
Bye.